it's become relevant that there's a misunderstanding why a country the size, the diversity, and the population of the United States would have a different vaccine schedule than a country that's barely the size of one of our states. So let's get into that. My partner, who is a bit older than me, has about 10, 15 years more experience. He tried to reassure me that, well, if families refuse hepatitis B in our community, which is rural, which is less populated, and the chance of an infant incidentally being exposed to hepatitis B virus and infection would be lower because we're just not as populated. There's not as much chance for exposure. It's a pretty bold statement, but there might be some truth to that. There are going to be communities that are protected because of their isolated nature. And we see this in our community when flu is worse in other cities and states. It takes a little bit, but it eventually gets to smaller communities like ours, and then it hits us pretty hard. So that's where that logic is flawed. Number two, the logic is flawed because the point of hepatitis B vaccination is not just to protect individuals and, small communities. It's to protect the community. The community deserves public health. The community deserves a safer environment where they're not at risk. Children deserve to be protected as soon as possible because one of the most important facts about hepatitis B infection is the younger you are, the worse the disease. The prevention is so safe that we give it to newborns. That's the way you need to look at it. Not why are we giving it to newborns whose mothers do not have hepatitis B in their bloodstream. Well, first of all, we'd be really worried about the infant if their mom did test positive, and we'd give them a second medicine called hepatitis B immune globulin. So we do test for that. We do look for that. And in the rare instance that we find it, we treat it. But immune globulin does not prevent infection per se. It makes it less likely. There is no treatment for hepatitis B infection. There's only the prevention. And it's better to prevent it as soon as possible instead of chancing it and allowing your infant or child to get it later incidentally. Now, how would they get it incidentally? Caregivers, surfaces, blood transfusions, bites, lots of different ways. It's not necessarily an adult behavior or a poor choice behavior or a promiscuous behavior or a high-risk behavior that involves infected needles. It isn't always those things. That misconception that the people that get the infection, quote unquote, deserve to be infected because they were doing bad things. We have to get that kind of thinking out of our heads because I don't approach patients that way in medicine. I want to prevent even the people making poor choices, especially the ones choosing not to vaccinate their kids. I want to protect them from that poor choice. But here we are. The prevention is always safer than the infection. The infection is always worse than the prevention. Period.